Today we're giving you a glimpse at the newest tests, treatments, and cures that could change your life, like this new plastic surgery technique. Could it be right for you?
Today what I'm going to do is a rapid recovery breast augmentation. There's basically 4 components to this. The first component is injection of long-acting local anesthetic. That's going to make her feel more comfortable the first night after surgery. The next component is placement of Botox or botulinum toxin in the pectoralis muscles. And that's going to help decrease pain in the several months after surgery and also help the implants to drop into a little more natural position. The third component is the way I insert the implant. I use a special device called a Keller funnel. That allows me to put the implant in through a really tiny little incision with less trauma. Less trauma means less pain. And the implant just goes right in just like that. Perfect. The final step is the use of LED lights. She puts it on her breasts after surgery for about a week, a few times a day, and that's going to significantly decrease bruising and swelling and give her a faster recovery.
We have my colleague, plastic surgeon, Dr. Matthew Schulman, along with his patient, Alini. Welcome. Now, I've been doing breast augmentation now since the early 80s. This is different. What made you think of adding Botox to a breast augmentation?
Well, this is really exciting because what I did was I took what you and I both love about Botox and applied it to the most common cosmetic surgery procedure in this country, which is breast implants. So by adding the botulinum toxin, the Botox, to the muscle, it allows the muscle to relax. It allows that implant to drop into a normal, pleasing position within a matter of weeks instead of months, and also decreases the pain.
This is innovative stuff that is really cutting-edge new stuff. Typically, that implant rides a little high just because the muscle is tight, especially in smaller women, and this just helps it loosen up.
So what happens when the Botox wears off after 3 months, 4 months? Is it where it needs to be? The implant
that's the beauty of it. I mean, you want to allow that muscle to be relaxed for the first 3 to 4 months of the recovery, which is the lifespan of the Botox, so the timing is perfect. When it wears off, your implant is where it's supposed to be, and everything's great.
And Dr. Schulman, take us through this animation to show us again exactly what you're doing in terms of your augmentation and adding the Botox.
So what I'm doing is I'm making my incision, whether it's under the breast crease or around the nipple, and I create that pocket underneath the muscle where the implant's going, and before that implant goes in, I'm injecting botulinum toxin, Botox, into the muscle in very specific locations where I want that muscle to be relaxed. And I'm not paralyzing the chest muscle, so it doesn't affect arm movement, normal activities. It just relaxes it exactly in the place where I need it to be relaxed.
Pretty big dose of Botox you're giving, right? How many units?
I give 80 units of Botox total, but it sounds like a big dose, but it's just a little bit more than we would give to your normal 60-year-old patient who's getting Botox in her face.
Works.
So it's perfectly within a safe level of treatment dose.
And Alini, you look great. How do you feel?
I feel great. I mean, I love the result. It's natural. It doesn't look fake.
We do have some other before and after. Tell us what your thoughts are on these.
Well, you can see the before and the after of her picture. And the thing about this is only 1 month afterwards. And this is the exact result you would expect at 4 months after a traditional augmentation without Botox. So it's a faster final result, which is great.
And then you have a satisfied patient.
Yeah.
Thank you both so much for being here today.
Thank you.
Thank you.
Awesome work.
Coming up, find out